Welcome back. I think it's safe to say that most moms have a specific plan or how they imagine their baby's birthday in their head, their very first birthday when they're born. And a lot of moms want to have a birth plan. So joining us today is Jessica Pyrah. She is a registered nurse at Heber Valley Medical Center, here to talk about birth plans. Thanks so much for coming in.
Yeah. As a prenatal educator, it's one of the questions that a lot of new moms ask, do I need a birth plan? And the simple answer really is no. They're not a necessity, but if you'd like to prepare one, we're welcome to take it.
So if you do write up a birth plan, is this something that you have and you maybe drop off at your doctor right before the birth, or do you bring it with you the day that the baby's born? What do you want to do with it?
Really both. The very first thing you need to do is talk to your delivering provider about the birth plan to make sure it's something that they're comfortable with. You also want to bring a copy to the hospital so the nurses can see that. It's really mom's wish list of what she'd like to have happen during labor and delivery.
Moms really should get wishes, candles or not, there for when the baby's born. So what are some of the things you want to specify and put in there in case those are things that are important to you?
So, for example, some moms might put in things like they really want to have an unmedicated labor and delivery. They might want to bring in some items from home to help them during that period, that stressful period, things that help comfort them and calm them. How many people they want in the delivery room. Maybe I want my husband to cut the umbilical cord, things like that.
What about a backup plan? Because I have 2 children, and both times I was going to have a natural childbirth. It was going to be perfect, and I had it all planned out. And then it went in the complete opposite direction. One born at 29 weeks. They both ended up in NICU. Should you have a backup plan of, if things don't go as I'm planning, this is what I'd like to see happen, or can you not plan for those events?
I think you can't plan for those events. Really, what we want you to be as flexible and open-minded as possible, because labor and delivery is a fairly unpredictable area. So just be flexible and be willing to change your birth plan if it needs be.
Flexible and have fun, right?
Right.
She's laughing. There's really not a lot of fun until the baby gets there. Thanks so much for coming
You're
in
welcome.
and answering
Thanks
our
for having
questions.
us.